The Emory Global Diabetes Research Center is an ambitious and bold project. 500 million people worldwide are affected by diabetes, and that number is growing every day.
The idea of ending diabetes is very much a stretch goal, but I think we believe in stretch goals at this center.
Since 2011, Emory's Global Diabetes Research Center has been at the vanguard for diabetes research, training, and public policy around the world.
If you look at all the centers around the US that study chronic non-communicable diseases, really there isn't one that is focused on that global agenda as much as we are.
From South Asia to Latin America and beyond, the center has built substantive partnerships globally.
I've never seen a center work with so many different people from so many different countries.
It's not just the people that we've recruited, but the platforms that we've developed that make us, quote unquote, the mecca for global diabetes research.
In the 10 years of our center's existence, we've had major influence in terms of changing diagnostic criteria for diabetes, approaching the WHO in terms of influencing classification of diabetes, improvement in policy for prevention and treatment, generating the best kind of science, and training the next generation of investigators.
In addition to its global reach, the Diabetes Center has strong local collaborations.
Our network of investigators locally at Emory is about 110 faculty across all schools of Emory, and we also partner very closely with the Georgette Institute of Technology and with Mora School of Medicine. And in addition to this, we have connections and partnerships across several major universities in the United States.
The center prides itself on fostering aspiring scientists by supporting fresh and innovative avenues for research.
In my project, I'm bringing in single-cell RNA sequencing, which is part of genomics. And this technique is considered a novelty.
Yara Bey is a Ravi and Nalini Salagram Scholarship recipient and PhD candidate at the center.
This technique will allow us to understand what's happening at the cellular level, so we can understand the mechanism behind the development of type 2 diabetes.
EGDRC not only does research on how to treat these diseases and increase access to care for people with things like type 2 diabetes and cardiovascular disease, but also on how to prevent them in the first place.
People with diabetes don't usually have diabetes alone. They often have comorbidities. Diabetes has a long-standing bidirectional relationship with depression. So we've worked on that, and we've had trials focused on diabetes and depression. And increasingly, we've ventured into trying to understand the relationship between diabetes and COVID.
The problem is formidable, and the center's goals are ambitious. Lasting solutions must bring together a host of talent from multiple disciplines.
I think we each give a very unique perspective of how we can think about the problem.
The discovery of insulin was a remarkable incident in the history of science. This happened in Toronto, and the person who led it was Dr. Banting, who was an orthopedic surgeon. It tells you how great discoveries can come from any discipline.
I think that's one of the great things I've learned about the Global Diabetes Research Center is I've been exposed to a lot of different problems, right? And being able to see how computing can help has been really eye-opening.
The center leads the way in developing sophisticated algorithms that more carefully drill down into root causes and successful therapies.
I think AI has the potential to do what insulin did 100 years ago in terms of having that sort of impact.
Since insulin's discovery in 1921, the field has become infinitely more complicated. The center, meanwhile, is helping to facilitate faster and more effective diabetes care.
Now patients are seeing their own data. They're looking at trends. They're receiving alarms that alert them about severe hyperglycemic or hypoglycemic episodes.
The center has also cast a bright spotlight on health disparities, both at home and abroad, using evidence-based practices to guide research and policy.
Today, a large proportion of people worldwide can't afford insulin, can't afford medications for diabetes, and unnecessarily die of diabetes complications. This should not happen.
The center, with its Indian collaborators, has spearheaded the massive CARS cohort, a study of 22,000 adults that will allow scientists to gain insight into the prevention of diabetes.
I think that in the next 5 to 10 years, our center is going to make huge advances in how we think about diabetes, how we categorize the different types of diabetes, and how we really think about connecting people with the right type of medication that works for their particular phenotype of diabetes.
100 years from now, I know it's very difficult to foresee, but I am hoping we would be celebrating people not using insulin anymore and finding a cure for diabetes, and hopefully before the 100 years.